Okay, here we go. Hi, my name is Jessica Graham, and this is my submission for my informative speech. Thank you to my lovely coworkers for being my audience tonight. Topic of my speech is alternative therapies for kidney stone disease. A little bit about kidney stones. Kidney stones are caused by an excess of usually calcium and oxalate, which crystallize in the urine and form in the kidneys. I am a kidney stone patient. I have had kidney stones for quite a few years. A little bit about my journey through kidney stones. This is actual imaging of some of the kidney stones that I've had from 2014, and then these three are from this year. Traditionally, modern medicine will treat kidney stones with surgical procedures, whether they are invasive or not. I've had the majority of the procedures done that most doctors will recommend for kidney stones, including lithotripsy, which is sound waves focused on the kidney stone used to break it down. A procedure known as a percutaneous nephroleptotomy, which is essentially a hole made in the back in which a tube is inserted, and then a laser is shot into the tube to break up the stone, and stone is sucked out. A ureteral basket retrieval, which is where a endoscope is gone up through the bladder, into the ureter, into the kidney, and a small wire basket is used to retrieve the stone, and as well as an intravenous pyelogram, which contrast dye is injected, and x-rays are taken to check for structural abnormalities in the kidneys. About 1 in 10 women and 1 in 10 men and 1 in 35 women will have a kidney stone in their lifetime. Kidney stones can occur anywhere in the kidney, whether in the tissue itself or in the spaces known as the calyces in the kidneys. Majority of kidney stones are made of calcium oxalate. My stones are made of calcium oxalate. And this is what a calcium oxalate stone looks like, blown up. My condition is known as renal tubular acidosis. Basically, that means there's a malformation in the drainage tube in the kidney that causes the crystallization of calcium and oxalate and causes stone. So, throughout my journey with kidney stones, I started looking for alternative therapies. Like I said, I've had several surgical procedures done, and I was looking for something different. I got tired of being put under the knife and put to sleep, and it wears on a person. So I turned to one of my good friends. His name is Morton. He's a licensed massage therapist, and he specializes in deep tissue massage and cupping massage, as well as neuromuscular massage. He specializes in a bunch of things, and he's just awesome. This is Justin here, and I started looking into massage therapy for management of my kidney stones. This is after my first massage right here, and usually the stones that I have are too large to pass, which is why I require surgical intervention. What I've discovered is after I started with the massage therapy is that I actually started passing fragments. In 2 months, I've passed 16 fragments, which drastically reduces the amount of overall pain that I have. The technique that Justin uses relaxes the skeletal muscles and helps reduce anxiety overall, which causes tension. And one thing that I love about massage is that it's so much less intimidating than walking into a hospital or doctor's office. This is a picture of Justin's office down here. You can see it's nice, peaceful, calming. There's usually essential oils going, nice calming music. You walk into the doctor's office, it's stark white, smells like a hospital and antiseptic, and it's just kind of intimidating. When I talked to Justin, he agreed to interview for this presentation. I asked him why he thought more people weren't referred to massage therapy for kidney stone management when it's recommended by so many people in the massage community. And basically what he told me was that it doesn't make doctors money. So even though it's for the benefit of the patient, it's less invasive and it has multiple beneficial effects. it's really sad to see that more patients aren't referred for massage therapy. Not only have I seen a decrease in my kidney stone symptoms since I started massage therapy, but I've seen a decrease in sciatica pain and tension headaches and all kind of wonderful things. The second thing that I wanted to look into in alternative therapies for kidney stone disease is nutrition therapy. Most of the time, whenever you walk into, that's over here in pink, most of the time when you walk into a doctor's office, you get diagnosed with a kidney stone, they run your stone, they'll send you a sheet and it says, here, don't eat this. Nutrition therapy goes a little bit beyond that. It's sitting down with a dietitian, working out a meal plan, and discovering what works for you and what doesn't. The American Journal of Renal Dietitians recommends nutrition therapy secondary to surgical intervention as a way of prevention of kidney stones, whereas massage therapy is more management of symptomatic episodes. I have here a list of some high oxalate foods to avoid. Most common ones are chocolate, spinach, nuts, beans, and that's more leaning towards patients with calcium oxalate stones like I do, like I have. However, most patients with kidney stones are instructed to increase their citric acid intake, particularly with lemons, because citric acid is known to break down most types of kidney stones, not just calcium oxalate stones. A couple of other little known techniques for managing kidney stone symptoms, much along the lines of massage or yoga. Yoga can help to relax the muscles and relieve tension off of the ureter, particularly if there's a obstruction of the outflow of urine. And essential oils can also be used to manage pain symptoms, whether it's musculoskeletal or deep visceral pain in the ureter, or just to relieve anxiety associated with that pain. And there's my presentation. Thank you so much.
Very informative.
I think that's pretty cool.